Welcome. Our today's topic for third year MBBS MCQs is to describe the sources, types, causes, hazards, and prevention of radiation exposure. First question. A 32-year-old radiology technician has been working in a diagnostic imaging department for 7 years. He develops early cataract formation. Which of the following best explains the underlying cause? The correct answer is C. Chronic exposure to ionizing X-rays without adequate shielding. Second question. A patient undergoing radiation therapy for cervical cancer develops nausea, vomiting, and bone marrow suppression. These effects are best classified as. The correct answer is A. Deterministic effects of radiation exposure. Question 3. During a fluoroscopic procedure, the radiologist adjusts the distance between the X-ray source and the patient to reduce exposure. Which principle of radiation protection is being applied? Answer is B. Application of the inverse square law. Question 4. A pregnant radiographer is assigned to work near CT scanners to minimize radiation risk to the fetus. The most effective preventive measure would be. Answer is B. Standing behind lead shielding during scans. Question 5. A 60-year-old male develops thyroid carcinoma years after an X-ray series done for chronic tonsillitis in his youth. This represents which type of radiation effect? Correct answer is C. Symmetric stochastic effect. Question 6. In a nuclear power plant accident, a group of workers are exposed to higher doses of gamma radiation. Within hours, several of them present with nausea and vomiting. This clinical picture is most consistent with. The answer is B. Acute radiation sickness. Question 7. A diagnostic radiographer ensures that her badge reading does not exceed the annual dose limit. This monitoring primarily helps in preventing which of the following? A. Stochastic effects. B. Genetic transmission of mutations. C. Deterministic effects. D. Non-ionizing hazards. E. Radiation dermatitis. The correct answer is C. Deterministic effects. Question 8. A radiology department installs lead-lined walls and uses controlled access areas for imaging suites. These measures are primarily intended to. The correct answer is B. Prevent overexposure of staff and the public. Question 9. A 10-year-old child receives multiple CT scans for recurrent head trauma. Years later, he develops leukemia. Which of the following best describes this outcome? The correct answer is A. A stochastic probability-based effect. Last question is, a radiologist describes to use pulsed fluoroscopy rather than continuous fluoroscopy during a long orthopedic procedure. The rationale behind this modification is to. The answer is B. Decrease exposure time in radiation dose. Thank you.